Hi, my name's Jodi Allen. I'm a speech and language therapist here at the National Hospital for Neurology and Neurosurgery in London. I'm here today to talk through the bulbar impact of motor neuron disease on swallowing and nutrition.
As muscles begin to waste, swallowing becomes more difficult. Swallowing problems affect at least two-thirds of people living with MND during the course of their illness. This affects their ability to get sufficient nutrition and manage saliva. As swallowing becomes difficult, the person may be tempted to eat and drink less and avoid foods that cause problems. They may also limit their food and drink intake as a way of reducing the number of trips to the toilet. A drop of intake can lead to malnutrition, and in turn, weight loss, feeling tired, and loss of strength. It can also lead to constipation from dehydration, a change of diet, and poor mobility. It can affect skin condition, and skin may become loose, dry, and flaky, and there will be an increased risk of developing pressure sores. For this reason, we work closely with the dietitians. In addition, if food and drink goes down the wrong way towards the lungs, it can cause chest infections, known as aspiration pneumonia. Weight loss can accelerate the muscle disease, and as a result of malnutrition, the respiratory muscles may weaken. It may affect immune function and can increase susceptibility to opportunistic infections. Swallowing the necessary medication during times of infection may also present issues. It is important to recognise that eating and drinking is a social activity. It is where friends, family, and loved ones catch up, and the inability to eat and drink normally in a social context can have a high emotional impact on people living with MND. Support from the multidisciplinary team is essential. We work closely with dietitians and physiotherapy colleagues, as well as occupational therapists. A speech and language therapist can assess and advise about eating and drinking techniques to ensure a safer swallow and additional comfort when eating and drinking. A dietitian can provide guidance on food types and consistencies, or dietary enhancement and supplements to keep the person well nourished and hydrated. An occupational therapist can advise on posture and equipment for food preparation or eating aids to help as weakness develops in the arms and hands. A physiotherapist can provide advice on posture, exercise, assisted exercise, and how to deal with any experiences of choking or respiratory infection. During mealtimes, you might advise or provide support as follows. Ensure the person maintains a good fluid intake. This is particularly important for patients who are taking thickened fluids. Suggest meals which may be less tiring. Make food appear more appetizing, add garnishes, and create a colourful plate of food. If the patient has any food preferences, incorporate these foods into the diet, making sure the foods are of an appropriate texture. As meals can take longer to eat, allow plenty of time and keep food warm or reheat if necessary. Encourage eating in a relaxed, quiet environment which may reduce anxiety. One treatment to optimize nutritional status is a gastrostomy tube. This is a thin feeding tube implanted surgically into the stomach through a small cut on the surface of the abdomen through which a person may be fed directly. This bypasses the mouth. This method may meet all of the person's nutrition and hydration needs, or be used as a top-up so that a person gets the necessary nutrition but may continue to eat a small amount orally to maintain some pleasure in social eating. A number of patients may continue to take small amounts orally for comfort and quality of life. The tube must be kept clean and clear but shouldn't restrict daily activities. It is advisable to have the tube inserted before the breathing muscles are significantly weakened, even if it isn't used for feeding until some time later. There are different ways of doing this depending on the person's health at the time. Gastrostomy is not suitable for everyone and may not be the treatment of choice for some people. The pros and cons of gastrostomy should be discussed to enable the individual to make an informed choice. Any discussions about gastrostomy should involve the dietitian and should cover what is involved to ensure that they or their carer can physically manage the intervention, how alternative feeding can affect quality of life, any possible side effects, and how gastrostomy feeding may be included in an advanced decision to refuse treatment. Difficulties in swallowing can cause problems managing saliva. Some patients may have thin saliva that draws from the mouth or makes them cough or choke. Thick saliva is more difficult to clear, and in some cases, oral hygiene can be affected. Changes in posture and positioning can help reduce instances of drooling. Saliva can also be treated by certain drugs. One widely used medication is hyaluron hydrobromide skin patch. This was originally designed to treat motion sickness, but it has since proved helpful in drying up flow of saliva. Amitriptyline, or atropine eye drops, applied under the tongue, and glycopyrrolate are alternative medicines that can be used to control drooling. The NICE guidelines lay out the recommendation of medications in more detail. Relevant dosages should be checked in the British National Formulary or Palliative Care Formulary. If medication proves unsuccessful, botulinum toxin or Botox injections or radiotherapy may be considered. If medication is overprescribed for saliva, a person with MND may experience thick saliva or a dry mouth. At this point, it is helpful to check that the patient is sufficiently hydrated. Suctioning may help to clear saliva, and again, posture and positioning may assist. Humidifications can help, and certain medications in the forms of nebulizers or carbamazepine may also be considered. For additional information, the NICE guideline on saliva will be of support.
We hope this presentation has been useful to you. If you'd like any more information, please don't hesitate to contact your local speech and language therapy team as well as your dietetic team.